Hello, my name is Connie Rhee, and I'm the editor-in-chief of the Clinical Journal of the American Society of Nephrology. I'm honored to be here today with Dr. Mohammad Azfar Qureshi, who was our 2024 second place CJASN Trainee of the Year awardee. He currently works at Toronto Sunnybrook, and his study is focused on the Association of Intra-abdominal Adhesions with PD catheter-related complications. Dr. Qureshi, can you kindly introduce yourself to the CJASN audience?
Thanks, Connie and CJASN for this invitation. It's an honor to be here. I'm a clinician and researcher from Canada with background in internal medicine, nephrology, and master's degree in clinical research. I got trained at the University of Toronto, completing fellowships in general nephrology, home dialysis, and point-of-care interventional ultrasound at Sunnybrook Health Sciences Center. I have a special place for home dialysis and in particular peritoneal dialysis. This focus on PD is not only professional, but in fact personal. My wife is a PD nurse, and we share common dedication towards enhancing outcomes for PD patients.
This is so touching and wonderful to hear. Now, what motivated your interest in this research area?
My interest in this research area began during home dialysis fellowship training at Sunnybrook, where we have a very motivated home dialysis team. Under the mentorship of Dr. Matthew Oliver, we encountered cases of PD complications which were linked to catheter insertion. Dr. Oliver is a co-founder of the North American Registry for PD catheter insertion. His insight was actually instrumental in identifying knowledge gaps, especially regarding adhesions. The registry collects data from 23 large centers across US and Canada, particularly related to the techniques and practices involved in PD catheter insertion. Observing these challenges firsthand inspired us to access registry data and study how previous surgeries and adhesions affect PD outcomes. Hoping to bridge these gaps and improving care for PD patients, we wanted to explore these issues so we can provide clear guidance to clinicians to achieve better outcomes for patients choosing PD as their dialysis modality.
This is quite extraordinary. And what specific research questions were you hoping to address with your study?
We aim to answer three main questions with our study. Firstly, what factors are associated with the presence of intra-abdominal adhesions? Secondly, how are these adhesions linked to PD catheter-related complications? And thirdly, what abnormalities arise during PD catheter revision procedures, and how can we manage these more effectively? I think by understanding these questions, we could develop better understanding of these relationships, leading to more informed decision making and better patient care for those who choose PD.
This is fascinating. And what were the main findings of your study? Also, what were the main strengths and limitations of your study?
Firstly, our study found that adhesions were present in 27% of patients undergoing laparoscopic peritoneal dialysis catheter insertion, with significant association between prior abdominal surgeries and adhesion formation. Secondly, adhesions were associated with risk of complications such as flow restriction and abdominal pain, leading to either PD never starting or early terminations. Thirdly, adhesiolysis, which was performed in less than half of the cases, showed only modest and statistically non-significant effects in reducing these risks. However, we also wanted to highlight some other important implications. 45% of patients with prior abdominal surgery actually did not form adhesions. An increased number of surgeries actually did not significantly increase the risk of adhesions. We concluded that most of the complications were procedure related. Most patients with or without adhesions did not experience complications, and majority of complications did not lead to termination of PD. Our study's strengths lie in its large multi-center design and prospective data collection, thus providing a robust understanding of the incidence and impact of adhesions in real-world setting. One of the limitations was that we only included patients undergoing laparoscopic peritoneal dialysis catheter insertion because adhesions are not visualized when performing percutaneous bedside insertion. Additionally, although we reported on adhesions, we did not use standardized classification system for adhesions. Data on adhesions was based on operative reports, which tend to be subjective and can vary from procedure to procedure.
Thank you for sharing your expert insights. Now, what are the next steps for your research? Following your study, what are the future directions the field should be heading in?
I think future research should focus on developing standardized methods to assess and classify adhesions. Also, future studies are needed to study the role of different surgical procedures in preventing PD catheter complications. Studies are also needed to understand how and why new adhesions form, how can we mitigate the risks of adhesion formations in different patients, and whether different approaches to adhesiolysis can be more effective. I also believe that we need better risk stratification tools to identify patients who might face higher risk for PD catheter-related complications before surgery. Perhaps in the future, AI can help in better patient selection to improve on such outcomes.
Thank you for your recommendations. And what words of advice or wisdom do you have for people who are interested in pursuing research training with a focus on kidney health?
For those interested in kidney health research, I would advise embracing a multidisciplinary approach. Kidney care intersects with various fields such as surgery, radiology, and internal medicine. So it's imperative to develop strong collaborations with other healthcare professionals. I think it's important to remain curious and driven to find solutions to the challenges of our patients. Our patients with kidney disease suffer from multiple complications, and these can be as simple as pain and pruritus, or as complicated as cardiovascular diseases and malignancy. I think we should strive hard to find answers to their issues, which will only come through research. I think improving patient-centered outcomes is crucial. And lastly, having a strong mentorship program with an experienced supervisor can bolster such research forward by several magnitudes.
I would like to thank Dr. Qureshi for taking the time to share his outstanding research with the CJASN readership.
Thank you again, Connie and CJASN, for giving us this opportunity for highlighting and recognizing our work. Thanks so much.
And many thanks and in gratitude to all of our CJASN readers for taking the time to dial into this important podcast showcasing Dr. Qureshi's work.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.